Alright, so the first test is Tunnel's sign. You need to find the posterior tibial nerve right here. You're going to tap on it. And a positive test is tingling down into the foot, which is going to indicate tarsal tunnel syndrome. Next test is Morton's test. You're going to take the foot and you're going to apply pressure through the metatarsals. And if they have pain in between any of the metatarsals, it's going to indicate a Morton's neuroma. Usually it's going to be between the third and fourth metatarsal. The next tests are going to be for the ankle or the lower leg. So the first test is called the percussion test. So it's going to check for a fracture anywhere in the ankle or the lower leg. You're going to take their foot and you're going to apply percussions to the bottom of the foot. And if they have a fracture, they're going to feel it somewhere along where the fracture site is. And then the second test for identifying fractures is called the compression test. So if you suspect a fracture down in the distal part of the ankle or the lower leg, you're going to apply compression at the top. And if they have a fracture, they should feel it down at the distal portion. Or if you suspect a fracture anywhere else higher into the lower leg, then you can apply pressure at the bottom, at the distal end. And if they have a fracture, they will feel it wherever the fracture site is. The next test is going to be a testing for an Achilles rupture. It's called the Thompson test. So you'll have the athlete lying on their stomach, lying prone on their stomach, and with their foot hanging off the table, and you will squeeze the calf, looking for movement in the foot right here. And if their Achilles is ruptured, then there will be no movement in the foot when you squeeze the calf. So that's the Thompson test. The next test is called Homan's sign. It's testing for a deep vein thrombosis, which is a blood clot. So you're going to have the athlete sitting on the edge of the table, and you're going to passively put them into dorsiflexion, which is putting stress onto their lower leg. If they have a deep vein thrombosis or a blood clot in their lower leg, they will have pain in the calf. The next test is the anterior drawer test. So this is going to be testing for an ankle sprain. So you're going to stabilize at the ankle, holding the back of the foot, and you're going to pull forward. So this is testing all of the ligaments on the medial side of the ankle. And if they have an ankle sprain or laxity in any of these ligaments along this medial side, you'll see movement as you pull forward. So I'm just pulling anteriorly. Next test is the talar tilt test. So you're going to basically recreate an inversion and an eversion ankle sprain. So the first one you're going to do is you're going to grasp the bottom and you're going to stabilize at the ankle up here. And then you're going to invert their foot, and then you're going to evert their foot, just like you would if they actually injured their ankle. So let's try it from this angle. So I'm going to invert her foot, and then I'm going to evert her foot. And if they have an ankle sprain, or if any of those ligaments are messed up, they'll feel it with that recreation in the talar tilt. And then the last ankle and lower leg test is called Kliger's, and you're going to dorsiflex and externally rotate. So this test is testing for a high ankle sprain, which is where the talus is pushed up in between the tibia and the fibula. So by dorsiflexing and externally rotating, you're kind of opening up that syndesmosis in between the tibia and the fibula and recreating a high ankle sprain with that. So that's Kliger's test. So these are the first two tests for the knee. The first one is going to be the valgus test, which is going to test the MCL. So you're going to take the knee, you're going to place your hand on the outside of the knee. You're going to do it at 0 degrees first, and you're going to put inward pressure and try to stretch that MCL. And then you're going to put her at 30 degrees of flexion and do the same thing and really try and stress that MCL. So if it's at 0 degrees and they have pain, that's going to be the medial capsule of the knee. And if they have pain or laxity with the 30 degrees of flexion, it's going to be more straight MCL. The second test is going to be the varus test, which is going to test the LCL. So it's going to be exactly opposite of the valgus test. You're going to have the pressure on the inside of the knee. You're going to start again at 0 degrees and try and stress the outside of the knee. And then you're going to go at 30 degrees, do the same thing, try and stress the outside of the knee. Again, if it's at 0 degrees and they have pain or laxity, it's going to be the capsule. And then if it's at 30 degrees and they have pain or laxity, it's going to be the LCL. So the next test is going to be the anterior drawer, which is testing the ACL. So you want to have the athlete bend their knee up onto the table. You're going to sit on their foot, and you're going to pull anteriorly towards you to stress the ACL. And then you have the posterior drawer, which is going to test the PCL, and you're going to do the same thing, but now instead you're going to push forward and look for pain or laxity with that. So anterior drawer is ACL, pulling forward, and then posterior drawer is PCL, pushing backward. The next test is going to be testing the ACL again. This one is going to eliminate the hamstrings, so it's called the Lockman test. So you're going to support their knee, and you want to make sure they're completely relaxed, and then you're going to apply anterior motion on the knee, looking for that ACL laxity again. So here I am stabilizing up here at the knee, and I am pulling forward, looking for movement or pain with that ACL test. The next test is called the Godfrey's test, and it's looking for PCL injuries. So you want to take their knees, and you want to come up, and you want to hold them at 90-90. And if they do have any kind of PCL injury, they're going to have a sagging on either of the knees. So you want to look from the side, and you want to look for any kind of sagging of the knees with Godfrey's test, PCL injury. So the next test is called McMurray's, and it's testing for the meniscus. So you want to take their knee up, and you're basically trying to recreate that grinding or clicking. So you want to bring them in and do some circular motions while you're feeling on the knee for any kind of popping or locking. And then you want to come the opposite direction with it. The second meniscus test is called Apley's compression and distraction. So you want to have them on their stomach and bring their foot up, and you want to press down and kind of twist and try and recreate that grinding of the meniscus. And if they have any kind of pain or clicking or popping with that, then you want to pull up on it and distract and do the same thing. If it's a meniscus problem, then this pain is going to go away with the distraction. If it's not a meniscus problem, then there's probably still going to have some pain or some kind of clicking and popping with the distraction. So you're going to first do the compression, look for clicking or popping, and try and relieve that clicking or popping or pain with the distraction. So that's Apley's compression and distraction. The first test in the hip that we're going to do is the Thomas test, which is testing for hip flexor tightness or hip contractures. So you're going to take the unaffected side and you're going to flex it all the way up, and you're going to look for the other leg to come up off the table. So see how her leg is coming up off the table a little bit, and then you're going to do it again just to see. So if it's a positive test, this leg will come up off the table like so, and it's either going to be hip flexor or other type of hip contracture. Next test is the Faber test or the Patrick test. So you're going to put them into a flexed, abducted, and externally rotated position like the figure 4. And you're going to apply pressure at the knee here, down. And if they have pain in the hip or in the SI joint, that's going to indicate either a hip injury or it's going to be an SI injury as well. The next test is the Ober's test, which is going to test for IT band tightness. So you want the athlete sideline, you want to stabilize them at the hip so they don't fall backwards. You're going to flex their knee back and then extend their hip, and you're looking for the knee to fall in, which is what's going on right now. Her knee is kind of in right now, which is indicating that her IT band is not tight. If it was a positive test, it's going to be up like that more because the IT band is tight and holding the leg up. So the next test is the Trendelenburg test, which is testing the gluteus medius tightness, or weakness. So you want to have them lift up the opposite side. So if we're going to be testing the right side, we want her to lift up the left side into a flexed position. So if you're going to lift up, and notice how her left side, the hip comes up, which is normal. If they have glute med weakness, then this side is going to drop a little bit in order to compensate for the